And it's a complete honor to be interviewing you today and getting the chance to delve deep into the workings of Asian Women for Health and how a peer-led community works for better health for its Asian women counterparts. So, we have curated certain questions that will help us understand the maximum about your work in this limited amount of time. So, shall I start with the first question?
Yeah, please go ahead. Yeah.
So why is AAPI Heritage Month important, especially this year, considering all the happenings that are going on in the world, and how has it changed from last year?
Well, I think the AAPI Heritage Awareness Month is extremely important this year because during the pandemic, we have encountered and experienced many physical and verbal attacks. And we need to use this opportunity to make Asian Americans more visible, and we need to be more vocal to talk about and to celebrate our heritage and to embrace not only the differences among different ethnic groups, but also how we can work collectively to advance health equity for all, and how can we show up in solidarity for the other impacted, the other marginalized populations.
That's great. And the thing that you mentioned, working together is something that's really important. And I'd like to know more on how this community is helping and is helping the patients, or it's helping the Asian women.
So at Asian Women for Health, we have three core values, or everything we do is follow these three pillars. So we educate, we advocate, and we reciprocate. So we encourage everyone, whoever come through us, whether they're program participants, whether they're volunteers, whether they're staff or partners, or or our sponsors, we ask them to stay involved and also to pay it forward, to share what they've learned, or to help the other person, the fellow Asian women or girls, however they can. So we see ourselves as like an incubator. We are the incubator to build the capacity, confidence, and also connections among Asian women, so they can not only survive but also thrive.
The three pillars that you just mentioned: educate, advocate, and reciprocate. I have written it down. So I wanted to know how does this help the women in particular? So do you approach the health centers, or do you go to the hospital? Is it in the form of money or assistance, or the facilities that are provided to them, or is it the doctors? Like how's the help given?
Right. So we deliver our mission through partnership with health centers, with other Asian agencies. We also do training, and we have a program called Achieving Whole Health, where we teach Asian women and girls how to set and maintain personal health goals. And during this 8 week, we pair them up with another participant in the program, so they can practice how to provide peer support for each other. And once they completed the program, they can apply and to be trained as a facilitator for this program, so they can then go on to recruit other participants and form their own cohort to continue this program. So one idea that we have is that we would like to offer this as a wellness program at work for companies, and because it's culturally responsive and gender specific for Asian women and girls. So if their employees go through this program, again they're eligible to be trained as a co-facilitator to run this program at their companies. So that and I know that a lot of the companies or schools, they're looking for contact-free, risk-free volunteer opportunities. So this is perfect because right now, this program can be done through Zoom or remotely, through technology, and it kind of cut down the barriers of time and space restriction. So and we have run this program in different languages. We have run for Korean women, we have run one for Japanese women. So this is a program that we hope that we can replicate the success and offer opportunity for people who wanted to really to help other Asian women and girls.
So my question was, if somebody, so yes, like I mentioned, I saw that in our website you also provide assistance and support for diseases that's as serious as cancer and breast cancer. So if a lady X develops breast cancer and is diagnosed with it, so what kind of assistance can she expect?
Right now we have a weekly wellness check-in group that's drop-in, so people can just come from anywhere, but they will have to, contact us so we can give her the Zoom information, and we can also connect them with other breast cancer survivors, so they can talk among themselves, because we don't have, we share certain cultural background, and sometimes it's helpful for people who can speak freely, with other cancer patients or survivors in their own native language.
That's amazing. And do you see any kind of disparity in the health sector and the ability to get proper health services between the Asian women and the normal white women?
Yes, definitely. So as I mentioned, cultural and linguistic barriers are the major factor that prevent Asian women from seeking timely treatment and also peer support. And that's why this is what we are focusing on. We have a nail salon outreach program where we send our health advocates out to visit nail salon workers when they're not busy working on clients, because we know that it's hard for them to take time off to get their mammogram and pap smear test. So we need to reach out to them and talk to them and remind them that it's important for them to keep their appointment, and also to advocate for them and to ask the employers to give them pay time off to do the screening. And we also on our website, you will see that we have different statistics on Asian on cancer that are disproportionately impacting Asian and particularly Asian women. So breast cancer is the most commonly diagnosed cancer for Asian women, and we've seen that there's an 89% increase of breast cancer among Asian women in Massachusetts. And we've seen that younger and younger Asian women develop breast cancer. So this is really a very alarming trend, and we need to remind people to get their mammogram and get their pap test. Again, certain disease disproportionately impacting certain subgroups. So for example, the Korean women and Vietnamese women have higher rate of developing cervical cancer. So we will, based on the information that we have, we do targeted outreach education.
I have seen that there are a lot of programs that are conducted by the community, like the ABC project and Achieving Whole Health programs. So if you can explain any of these programs to the viewers.
So the Asian Breast Cancer Project is a program that I founded in 2010. So the goal is to train other Asian women to deliver breast health education in their native language. So in the past, I've trained Asian women to do this in Vietnamese and Chinese. So we have materials that's developed by the Department of Public Health. And so, in the past, before the pandemic, we were able to go to other Asian serving agencies or other residents association where they have large Asian population to set up in-person workshops, and we talk to the residents or about the signs and symptoms, and also resources available for screening and the importance of screening. And the Achieving Whole Health program was a program that was adapted by the National Asian Pacific Islander Mental Health Association, and we further revised it to make it gender specific. So for example, we're adding additional modules to talk about body image. We talk about self-care and how to set boundaries, and all of this have an impact on our not only physical health but also emotional well-being. So the Achieving Whole Health is very similar to the chronic disease self-management program. It needs two trained facilitators to run this program. And you talk about all the basic things like, how do you have healthy living, healthy eating, and active living, and restful sleep. And like I said, we add some other more gender-specific modules to help Asian women and girls to have a healthier lifestyle and change their habits.
That's amazing, considering the amount of work that's been done, and the beneficiaries must be really grateful for all of this. So are there, apart from all of this, are there any social stigma or societal norms that are related to the AAPI community, especially the female gender, and when it comes to their health?
So I think that there's definitely stigma attached to all diseases, and particularly mental health, right? We know that Asian Americans are 3 times less likely to seek professional mental health services, and that's why we think that the Achieving Whole Health program provides a innovative way to as a prevention intervention program, because we give people a sense of belonging, and they don't feel the need to explain themselves, and they can share among each other in a very supportive and nurturing environment in a non-clinical setting. So although we always give the disclaimer at the beginning of the meeting, we said that this is not a group therapy session, but oftentimes we can, I think people can benefit from being with the other peers and hearing other people who are going through the exact same issues, and to get support for each other.
That's why it's called a peer-to-peer community, where each and everyone helps each and everyone. And if there's an outsider and that person wants to help you, in what ways can we also help you?
On our website, we have a link, and what we ask people to do is we ask them to fill the volunteer info sheet, so we can better match their skills and their interests with our needs, and also we will ask people to send us their resume, and we will set up like a interview by phone or by Zoom, and then then we can see if how much time that they can afford to volunteer with us, or do they want to just work on projects, because we have different projects or events. Like every year we have annual conferences. We just had one yesterday, and people can serve on the planning committee and help us to reach out to and to recruit speakers. We have an annual benefit fashion show called Celebrations, and people can volunteer to help us to reach out to potential donors and sponsors. And then we have another conference called Asian American Mental Health Forum, which will take place virtually this year on July 30th. And that event is entirely organized by volunteers and free and open to all. So we have many volunteer opportunities, and we have a lot of students who intern with us, and we help them with their capstone projects. So right now we have 2 interns who are interested in developing a workshop or webinars to help Asian family members, to talk to each other about their mental health needs. So there are a lot of opportunities. Yeah.
Great, and all of it does sound very interesting. So, all this time while you have been working for this cause, I'm sure there must have been a positive growth. So how much growth have you seen? How bad was it if we consider like 10 years ago, and how has it improved? And what is the future of Asian women and when their health is concerned?
So I wanted to mention another program or efforts that we're doing. So we received a grant to be the community engagement lead for the East Coast in the U.S. To help promote the All of Us research project. So All of Us is a national research project, and its goal is to collect over 1 million people's specimen, and they do extensive lifestyle interview with the hope that we can create the largest biobank in the U.S. history. And with this information, we then can enable the scientists to use the data to help predict diseases or prevent, to find cure or predict diseases. So this, I find that we do more and more work with a coalition approach. Like we're not just doing it, just Asian Women for Health, but we often partner and also collaborate with other Asian serving agencies. So this is an example. So we are coordinating a wellness awareness campaign, and it's going to be launched in June, and we are working with 5 other states to do this public awareness campaign. And we're also recruiting All of Us ambassadors. So these will be people who have enrolled in the All of Us project, and they can share about their experience. And also they will be what we call the community scientists, like doctors and who knows and who understand the importance of increasing the representation of all Asian American Pacific Islanders in clinical trials or research, because right now we're underrepresented, so we're underserved. So we need to change people's mindset, and we need to generate awareness and to encourage people to enroll in this kind of national study.
So with my next question, we'll be moving towards the end of the interview. And if there's one message that you'd like to give to our viewers, what would it be?
Take care of yourself. Self-care is very important, because if you're not well, you cannot give the best of yourself to the world. You can't just give what's left. It's a lesson that it took me years to learn, especially for Asian women. I think that we were brought up to, like always put other people's needs before ourselves. So, it's very important that we practice self-care, and also to support each other to take care of ourselves.
That line just hit me very hard. You can't just offer what's left, and that should be the line for every self-care magazine, I believe, because I've never heard this before. Well, thank you so much, Chien. And before we end the interview, there are two small rituals that we follow. So the first one is where we introduce ourselves and where we are from. So if somebody asks me, I'll say, yes, yes. I am gonna take note of all of these links and this last line especially. Yes, so the ritual is, so if somebody asks me about me, so I'll say, good morning everyone, this is Amrisha Chaurasia and I am from Delhi, India. So we are planning to make a collision video where we will put this description of all the NPOs that we have interviewed so far. So you can go ahead.
Hello everyone, my name is Chien-Chi Huang. I'm an immigrant from Taiwan. Currently, I live in Boston, Massachusetts.